All right, we'll get back to our continuing coverage of elections 2021, local government elections 2021 in a short while. But linked to that is something that we're all dealing with. And I guess it is a factor, right, in these elections in terms of how we're getting our lives back in track. We heard from the ANC president earlier on, Cyril Ramaphosa, encouraging people to wear masks and social distance using his president hat on Friday. He launched something called the Vooma Vaccination Campaign. Now to KwaZulu-Natal, where we find the Health Minister, Dr. Joe Phaahla. He's in the eThekwini district. He is accompanied by the KZN Premier Sihle, Zikalala, as well as the KZN Health MEC Nomagugu Simelane. And they are on this campaign to kickstart this door-to-door visit to various parts of Umlazi and Glebelands Hostel to drum up support for the COVID-19 vaccination rollout program. Mlondi Radebe is our eyes and ears on the ground. He's covering this story for us. Mlondi, reception to the message that everybody needs to get vaccinated.
Thank you very much, Blaine. We're in Umlazi V section today, where the National Minister of Health and Provincial MEC Nomagugu Simelane, they are campaigning. They are trying to make sure that everyone in Umlazi is vaccinating through the Department of Health as we speak now. Because you remember that the National President, Cyril Ramaphosa, have just announced that the Eastern Cape is the first province that is leading when it comes to vaccination. We'll just get from Dr. Joe Phaahla in relation to where is the province of KwaZulu-Natal in terms of vaccination. Minister, thank you very much for your time. Briefly about the vaccination program in South Africa. What can you tell us?
Well, the vaccination program is really moving steadily. We want to increase the pace. As we have said, that our target is to reach just at least 70% by latest end of December, possibly the middle of December. Now, to reach that number, it means that we need to reach at least 27 million adult people by that time. So that's why the President has given us this instruction to say we must go out, mobilize, work with our colleagues, the MECs and departments and all the health workers on the ground to make sure that more and more people must come through, because where we stand now, the numbers of people who have already got at least one jab is just under 13 million. So we need to reach by December, either end of December, possibly middle, we need to reach another 14 million people plus, about 14.5 million people. If we do that amongst the adult population, we'll have covered the 70%. So that's why we're here with the MEC today to do exactly that.
The President have announced in the Eastern Cape in the last hour saying that the Eastern Cape is number one when it comes to vaccination. Where is KZN?
Well, KZN, let me say KZN started very well. When we opened up the over 60s, over 50, it was really moving very well. Somewhere in the middle, there was a bit of a disturbance, as you would remember, the disturbances which were here. But it looks like there were also some increase in terms of false news about what the vaccine can do, and we started to see KZN dropping. So at the current moment, KZN is just under 30% of the adult population. It should soon get into 30%. So it's somewhere, as if I remember very well, it's somewhere around number 5 or 6, yeah, around that. Those which are still below 30% of the population is just below Gauteng. Although, of course, we know Gauteng is the highest population. So we're really working closely with the team here, because KZN is very important in terms of national coverage, because it's got the second highest population in the country. So that's why we're really working with them to try and encourage the population. It's very important that KZN also gets very close to 40% of the adult population.
How easy or difficult is to campaign during this time, the Vooma campaign?
Well, we're up against a whole lot of misleading news. Despite all our attempt to spread the correct message, you still hear a lot of people who are fearful, who hear that the vaccine is going to kill you. Some of them have had stories about it's going to change their bodies. Despite all our efforts, but we are not giving up. We need to keep on talking, keep on listening, and then responding. So that's why we go where people are. We'll be going to some houses, going into the taxi ranks, just to make sure that we can understand those who are still hesitating can come and take the vaccine. But I'm very encouraged. I mean, 2 days ago I was in Ladysmith and then also in Escort on Friday. Today I'm here. So the idea is to really interact with people so that in our communication already, for instance, the young lady who was here, just as an example, the gogos at home are not able to come here. So those are some of the things we need to respond to. So the team, MEC's team, are going to go with the mobile to go and give the vaccine. So it shows that in some instances, especially with the older people, it's less of the false information. It's more of sometimes just being unable to access. So you got a combination. The younger people, because of the social media, they get all sorts of confusion, and that's why we must explain some of those things. But there are also, especially your older people, sometimes they just don't have the necessary financial resources. So we must make sure that we go to them.
Thank you very much for your time.
Sure. Thank you very much.
There was the National Minister of Health visiting KwaZulu-Natal. He's still going to go to Glebelands to try and convince the people who are staying in Glebelands Hostel to vaccinate. We will also follow him there, and then we'll also get some more clarity on other issues as well. Back to you, Blaine, in studio.
Mlondi, before, I hope the Minister is still there. I just want to get his response with regards to some talks between UK scientists and South African scientists, as well as at the government level, with regards to President Cyril Ramaphosa and UK Prime Minister Boris Johnson about this red list that South Africa is on. Do you think we can grab the Minister and get his reaction with regards to this and the latest with regards to these talks?
Oh, okay. No, Blaine, I'll try and get it, Minister, to answer your question. Basically, Minister, the other issue is that South Africa is on the red list when it comes to vaccination.
UK.
What can you tell us about that?
No, the red list in relation to the United Kingdom, they are saying they are putting us on the risk countries in terms of visiting the UK. They want our people to be quarantined when they arrive there and so on. But we are discussing with them because the issue which they are raising as they are raising, they think that we are not giving all the information about the COVID statistics, and they still believe that we still have a dominant of the beta variant of the COVID-19, whereas we are now, the whole country is dominated by the Delta because they are using the AstraZeneca vaccine, which was found to be very weak on the beta. But we have our people, our scientists have met with the British scientists and they've exchanged information. I'm also going to be interacting with the Minister for Health. We're just waiting for the final, they've agreed that we need to talk so that we can give them more information. But we believe that after the interaction, they will be able to understand that South Africa is not a risk in the sense that we are rolling on vaccination, but we are also on top of the situation in terms of monitoring all the variants of the virus so that we know what is happening. So I think with all that information, we are very optimistic. I know President is also engaged, the Prime Minister. So we need to give them all the information. We believe that will be taken off from the red list because we want more interaction between the UK and South Africa in terms of trade, in terms of tourism. I think that matter will be sorted out. They said their committee will be meeting in the next 2 weeks. Hopefully they will remove us from the red list after that. Yeah.
Thank you, Minister.
Okay.
I think Blaine, Minister answered that question when it comes to red list, that talks are still going on. They are also furnishing more information in relation to what is happening. Back to you in studio.
Yeah, I guess it's a situation of watch the space. No doubt developing story. Thank you very much indeed for engaging the Minister there. Mlondi Radebe, live for us in KwaZulu-Natal. Minister was saying that by the end of December, they still want to get about, 14.5 million people to get to that threshold that says we reach some sort of herd immunity with regards to the vaccines. Look, scientists are talking about more and more about the vaccines, boosters, etc. You know, the United States has started the boosters. The President of the United States, President Joe Biden, received his booster shot. So, well, talks developing as we go on. We're learning more and more about the deleterious effects of COVID-19 every day. So scientists are coming here. We also got a story with regards to this pill that Merck has developed and saying that it can aid in terms of reducing hospitalization. We will bring you that story in a short while as well.